Welcome to this explainer. Look, if you're out there on the front lines of patient care, you already know that finding the right vein, selecting the absolute best device, and protecting that line is nothing short of an art form. So today, our goal is to completely demystify the process of earning your VABC. That's the Vascular Access Board certification. I am so excited to walk you through exactly what it takes to validate your incredible skills and finally get those well-deserved letters behind your name.
Okay, let's dive right into this. Vascular access is, without a doubt, a life-saving specialty. You guys are literally the superheroes of the hospital, protecting patients from complications, preserving their vessels, and delivering critical therapies day in and day out. Think of the VABC as your official, board-certified superhero badge. It's the ultimate proof of your multidisciplinary expertise. It shows you don't just know how to place a line, but you actually understand the clinical reasoning, the evidence, and the ethics behind every single decision you make.
So to get you to that finish line, here's our roadmap for today. We're going to cover 1. Eligibility and signing up. 2. Mastering the exam blueprint. 3. How to study effectively. 4. Exam day expectations. 5. What to expect during the exam. And finally, 6. After the exam.
Let's kick things off with Section 1, Eligibility and Signing Up. Before you even crack open a study guide, just remember that you already bring a wealth of bedside experience to the table, and honestly, the exam recognizes that. This isn't a test for someone trying to learn IV therapy from scratch. Here are the exact steps to get signed up. First up, you need to have at least post-secondary education and hold a clinical healthcare credential that requires vascular access skills. Because this is a multidisciplinary credential, whether you're an RN, an MD, a respiratory therapist, or an EMS professional, you are absolutely welcome here. Now, step 2 is crucial. You've got to accumulate at least 1 year, or roughly 2,080 hours of professional full-time experience. The exam expects a clinician who has seen a full year of real-world vascular access workflows. Once you meet those criteria, step 3 is simply to apply through the Vascular Access Certification Corporation, or VAC, for either their June or December testing window.
Moving right along to Section 2, Mastering the Exam Blueprint.
Once you're signed up and you've got your authorization to test, it's time to map out your prep. Now, what's really interesting about this breakdown is the weight distribution. It is so tempting to just study your favorite insertion tasks, right? Especially if you place a lot of picks or midlines. But take a look at these numbers. Patient assessment dominates the test at 18% of the scored items, and that's closely followed by troubleshooting complications at 16%. Device assessment and selection sits right there at 14%. You really have to study the entire continuum of care. The exam is testing your clinical judgment across all these domains, and that includes the often overlooked evidence-based practice and legal and ethical considerations. Honestly, just 10 scored items from those smaller domains can absolutely make or break a close score.
Okay, so how do we tackle this? That brings us to Section 3, How to Study Effectively.
As we shift your mental approach away from just memorizing textbook definitions to truly understanding complex patient care scenarios, I just love this quote from the Source Masterclass. It's all about matching the tool to the job. I want you to frame vascular access as a giant toolbox. I mean, you wouldn't use a hammer for a screw. Well, hopefully you wouldn't. A peripheral IV might be absolutely great for short-term hydration, but if your patient needs TPN or a harsh vesicant, you need central access. Your device selection should always be driven by the specific therapy needs of the patient, their vessel history, and their overall clinical picture.
So as you prepare, I highly recommend building out a comprehensive decision tree in your head. Focus heavily on selecting the least risky device that still meets the therapy need. You're also going to need to master infection prevention, remembering the nitty-gritty details like using a 2% CHG and alcohol scrub and letting it dry completely. You absolutely must understand imaging and tip confirmation. For example, knowing that an ECG-guided P-wave amplitude peaks right at the cavoatrial junction. And please, whatever you do, do not ignore the legal and ethical guidelines. You need to know the core elements of informed consent, understand that instructions for use, or IFUs, are legally binding, and know exactly how to advocate for your patient within your specific scope of practice. Mastering these areas, that is exactly how you turn basic memorization into true clinical judgment.
Now we're shifting gears into test mode. Section 4, Exam Day Expectations.
You've studied hard, you've mastered the blueprint, and now test day is here. Testing anxiety is completely normal, so let's just de-escalate that right now by covering exactly what will happen. VAC utilizes prometric testing centers, and I'll be honest, their rules are incredibly strict. There are no surprises here. You must arrive at least 30 minutes early.
You strictly require a valid, non-expired government-issued photo ID. Oh, and if your name has changed recently, you must contact VAC before test day or they will literally turn you away at the door. Absolutely no electronic devices, phones, reference books, or guests are allowed in the room. You'll be under video recording and direct observation the entire time. They will give you an erasable noteboard, but you have to return it at the end of the test to get your score. Knowing these rules going in ensures you won't accidentally forfeit your fees or your chance to test.
Which leads us directly into Section 5, during the exam.
All right, so you've checked in, put your stuff in a locker, and sat down at the computer screen. What happens next? Well, this brilliantly illustrates your timeline for the day. You'll start with a 15-minute pre-exam tutorial just to get a feel for the software. Then, the main event. You have exactly 2 1.5 hours to complete the VABC exam, which is 150 questions. Finally, there's a quick 15-minute post-exam survey. Now, pay close attention to this part. There are absolutely 0 scheduled breaks. Yep, even a bathroom trip means the clock just keeps on ticking. With 150 questions in 150 minutes, you really want to aim for a steady pace of about 1 minute per question.
But here's a little secret about the test. While you'll see 150 questions pop up on your screen, only 125 of them are actually scored. The other 25, those are pre-test questions. They're completely invisible and unscored, mixed randomly into the exam to evaluate them for future test takers. So please do not panic if you hit a weirdly difficult question, because you literally cannot tell which questions are real and which are just experimental. You just have to treat every single question as if it counts towards your score and keep moving steadily forward.
Let's completely clear up the grading process while we're at it. You might be super tempted to try and calculate your raw percentage in your head while you're taking the test. Actually, scratch that. Just stop right there. VCTAC does not grade that way at all. Instead, they use what's called a total scaled score. This is derived statistically to account for any slight variations in difficulty between the different versions of the exam. The scaled score ranges anywhere from 30 to 140. The absolute only thing you need to remember is that a scaled score of 90 is required to pass. So just focus on making the safest clinical decision for each question and let the statistical scaling take care of itself.
And finally, Section 6, after the exam.
You click Submit, and wow, a huge wave of relief just washes over you. You're done. The absolute best part of this Prometric system is that you don't have to wait weeks agonizing over your results. Your official results are emailed to you within just 1 hour of completion. If you pass, and honestly, if you follow this explainer, you're well on your way, you will receive a digital badge containing your certificate and wallet card. Depending on when you test, you can start using those prestigious VABC letters behind your name starting either July 1st or January 1st. And that hard-earned credential is valid for 3 full years.
So, what exactly happens when those 3 years are up? Well, 30 is your magic number. Over the course of your 3-year certification cycle, you simply need to earn and upload 30 continuing education credits related to vascular access. If you diligently log these CEUs in your candidate portal, you can recertify without ever having to sit for that computer-based test again. It is just a fantastic way to ensure you stay current with evolving evidence-based practices while easily maintaining your hard-earned credential.
So there you have it. We've covered the eligibility rules, we've broken down the blueprint, discussed the best mindset for studying, and walked through the absolute realities of test day. You have the blueprint and the roadmap right in your hands. The only thing left to ask is, when are you going to schedule this thing and officially prove your expertise as a vascular access superhero? Start planning your study schedule today, step into that testing center with total confidence, and secure your VABC. Happy studying, everyone.